The Tasmanian Community Fund presents the Breaking Barriers Building Futures podcast. Hosted by Michelle Swallow in conversation with Associate Professor Catherine Robinson.
Hi Catherine, thanks for joining us today. Just want to start by acknowledging that we are meeting on the lands of the Muwinina people who sadly didn't survive colonisation, but thank and acknowledge the Tasmanian Aboriginal community for its continuing custodianship of our land and our waterways and our skies, but particularly our community, and just acknowledge elders past and present, and the incredible work that they do, and all of the communities around Tasmania, and Tas Community Fund is always excited to work with Aboriginal people and continue to learn from them. But I also wanted to say a big thank you to you. So for those people who don't know Catherine is Dr. Catherine Robinson, who's an Associate Professor at the University of Tasmania and working in the humanities, but particularly around sociology and community. And Catherine and I have known each other for a few years now. And Catherine's particularly interested in children and young people and issues around vulnerability and homelessness, mental ill health, and education and issues like that. So for us, I thought, what a great person to talk to, because the Tas Community Fund strategy's changed significantly in the last few years to really look at, breaking barriers and building futures, and looking for us about how do we support young people and children who might have barriers to learning and education. And that's really focused on 8 to 19-year-olds. And I just went, well, there's some nice alignment there, knowing you've been doing some research with Ahuri, which I'll let you talk about. But we might just go through and have a yarn, and I'll ask you some questions too. But it'd be great if you could tell us a little bit about your role at the university and how long you've been here, and just a little bit about this role.
Sure. Well, first of all, thank you for having me along for this conversation. I've been at the university now for coming up to 3 years, and my title is Associate Professor in Communities and Social Justice. So to me that just sounds like a dream job description, quite frankly. But within that broad remit around communities and social justice, I still have a very kind of driving interest around the wellbeing of vulnerable children and young people, and particularly as their lives intersect with the issue of homelessness. Part of my role includes leadership of the Homelessness Collab, a little research and impact unit that's really trying to take a sort of program or strategic lens to thinking about how do we bring research and knowledge translation to improve responses to homelessness in Tasmania, but of course contributing more broadly than that as well. And as part of that program of work, which includes adults as well, early intervention for children and young people is definitely one of the core things that I'm working on at the moment alongside colleagues.
Mm. Fabulous. So many questions. What are the sorts of things that you're finding are really impacting on young people who are homeless in terms of maybe accessing any type of education, particularly for those young people who are unaccompanied? Yeah.
I think, I think it's really important to think about this as a kind of life course issue. So there are lots of immediate issues that impact a child or young person on the spot in terms of their ability to engage in and even just actually access a school, to be able to go there, to have a current enrolment and be supported to attend a school. But all these issues around being well enough and supported enough to be involved in education, of course, start right back when a child's born. And so in the lives of children and young people who have been taking part in the research that I've been doing, certainly recently, but right back, through earlier parts of my career when I was with the Social Action and Research Centre at Anglicare, what we're really talking about is lifelong cumulative trauma for children and young people who come to experience homelessness unaccompanied by a parent or guardian. So that's the kind of base that children and young people can be working with. Not every single one, but many. So when you have lifelong repeated trauma, not just a once-off extraordinary event such as a loss or one episode of violence. I'm talking about routine experiences that are traumatic from birth onwards. When that's a general part of how you are in the world, the impacts on your ability to connect with education are global. They're going to be practical, so who's going to help you make your lunch, who's paying the school fees, who's identifying a school for you to be enrolled in, if you don't have a parent who's closely engaged with you in your life, who's signing consent forms, right through to just who's even suggesting that it's a good idea that you attend school. And then, of course, the personal state that a child or young person might be in internally in terms of their psychological well-being, but also just a bunch of learning issues, cognitive issues, health issues, that if you haven't had the opportunity to be really well cared for, there's just so many different barriers that will impact on your ability to engage in school.
It's really complex. And some of what I've been reading about it, all of the issues you've talked about, but it is very much about even being aware of some of those life moments. So when do I go? How do I get there? What will I be doing there? If it's not something that you've ever talked about in a family setting or a peer setting, what are young people, particularly in Tasmania, telling you? Is it sort of particular places? So, is it more difficult into regional areas where there's a lack of support for those complex issues? I'm just, wondering what you're hearing out there.
So the AHURI project, the Australian Housing Urban Research Institute, is what AHURI stands for. AHURI funded project that I'm working on at the moment is about thinking through what does a good range of supported accommodation options look like for unaccompanied children and young people who are homeless or at risk of homelessness. And part of that project has involved sitting down with groups of children and young people over the age of 14 and talking to them about, within the supported accommodation setting and that broader context of homelessness, what are the kinds of supports that you most value and you most need? And some of us might expect them to say, well, I've got no one to drive me to school, I can't find my uniform, I need help because I know I need to go to school by law and I know I need to go to school if I'm going to get a job. They're not saying that. They're saying, I want food and I want a kind adult to love me, essentially, and spend time with me. So in terms of thinking about what is the priority for children and young people in terms of the care that they're seeking, when those basic needs of physical and mental health and an experience of being cared for and valued are not being met, the leap to attending school as your highest kind of priority, particularly if you don't even have a bus card or birth certificate and you've been expelled, how can that become a practical as well as meaningful priority for a child or young person in that scenario? So, and, that's where the barriers stem from. If we don't have basic care in place for children and young people who have experienced, serious and prolonged adversity, we can't be surprised if their engagement in school is poor, because actually who's even paying for them to get there if they don't have a parent or guardian, with them? Are our services even funded to transport children and young people to school? And I can tell you now the answer is no, they are not. So there's an interesting thought there around not just children's priorities but government priorities in the way that support services for really vulnerable children are funded. Are they funded to do the kind of care work that's actually needed for children?
Yeah, excellent points. And certainly from the Tasmania Community Fund, we've funded a number of different not-for-profits, some of which I know that you're involved with, like Homebase,
Yep.
to do different work with young people. And often it is at that more complex pointy end. And sometimes we've funded things like School Food Matters to set up some of those, making sure kids have got a good belly full of food so they can learn and concentrate, because we were hearing that was actually a bit of a barrier. Not knowing that anecdotally, but actually getting some evidence about it and seeing that it's made such a difference. But what we're not hearing is that policy context of let's fix it here, but what about the young people who are homeless or have had extended trauma, or they're not even getting access to that system? So that's an interesting point for us to be thinking about too. So how do we support a system change that might lead to young people getting transported to school?
That's right. And I think part of this is also thinking about what is the scope of vision of any one policy or any one government agency. So often the conversation about educational attainment in Tasmania is about, how do we get schools to do better? So in the work that I do, and it's an enormous privilege, the work that I do, I sit where that vision drops away and it's just darkness. So this is about all of the Tasmanian children and young people who are actually sitting right outside these systems. So the question is not it's both. How, of course, do we continue to improve our existing systems? But there's another system change around how do we extend those systems out to include those children who are actually beyond the current reach of education in the state, including, of course, children and young people who are homeless and unaccompanied by a parent or guardian. They're not even in these systems to begin that conversation around, let's prove your educational attainment. For them, what they're wanting is, of course, that care first, but then actually what they want is to be like normal kids. That's one of the most common phrases that is used in my research. They want to go to school every day, just like normal kids. But they're so far from that, not just through their own circumstances though, but because our systems are not set up to bring them in.
So you are in a privileged position, you said before, about listening and speaking with these young people. If they got a voice at the table and they were given perhaps, $1 million, what would they, do you think, do with that?
Well, first of all, they'd say, give me 10 million, not one.
Yep.
And I can say straight up, just again, on the basis of these recent dinner table conversations that I've been having with children and young people around the state, they want mental health care. And it's quite, it has taken me back a bit about how strong and upfront they are in that communication. In a group setting, I'll say, what's the key thing? If you could wave a magic wand, the kind of question you've just asked me, what would you want to see available to you in this supported accommodation service? And they say, we need mental health care. Why do you think we got here, Catherine? Things are not good for me. I'm not coping well. So we need that care in place, in-house. And then we can start to think about what are all these other issues. But classically, they will say, I can't go to school. I can't last half an hour without feeling like harming myself or crying or feeling really out of control or just feeling so angry. And when you look at the road that these children and young people may have travelled, yeah, that's right. So it's about bringing the right resources together at the same time, rather than this kind of sequential approach that we often have and expect. That's okay when everything's great in your life and you're well-resourced. You can move through school systems at the appropriate level at the appropriate time and do all those nice transitions from childhood into teenagerhood into, et cetera, on into tertiary education, whatever it might be. But these kids' lives are much more brutal than that, and so we need to do something differently.
Which is interesting, isn't it? Because in that federal government context, there's been a lot of money put into the less pointy end, so anxiety, depression, beyond blues, etc. Not necessarily focused on young people, some is. But there's not a lot in that middle zone because there's some from sort of the state government around, acute mental health need. But and you might remember that I've worked in the community mental health sector and it's grown, but it's still not really focused on young people unless you're talking about Headspace, which is more of a clinical model than necessarily that support in place. Yeah.
Yep. And again, the children and young people who've taken part in this recent project and previously in my work, they absolutely specifically nail that gap. And they will say, again, just front and centre, we know that Headspace is not for us. We get told at every turn, your needs are too high, you can't come here. So that's across different forms of available mental health care. And so that's what you're pointing to. We might have the acute end, some capacity there, and we might have the also needed, absolutely, the early intervention end. But for children and young people who've travelled this difficult path of cumulative trauma across a lifetime, early intervention work is not where they're at. They're in what I would describe as sustained crisis. So they don't tend to hit the acute button, but also our early intervention services are not set up nor funded to meet their needs. But for children and young people, that then translates into a narrative about sort of not being welcome, and we know there's nothing for us. There is no one for us, which it would be good if we listened to that narrative.
Yeah, interesting. Because there's so many different things you could do from a policy point of view, but it needs substantial funding as well.
Yeah.
And it's an interesting space for us because our focus is on how do we actually enable young people to live their best lives. And we know that, and you said it earlier about, it's probably when we were chatting earlier, but about, it's year 12 is not the end, but if you haven't even been able to get to, a day a week, you're probably not going to go on to further education, whether that's VET or uni or wherever it is. But to get a job in our current community, you need to have a high level of education. So we're really wanting to make sure that we can give Tasmanians young people those opportunities. But if they're really, as you say, in that sustained crisis mode and they're needing lots of support, it's a different model than what we've got in housing and mental health, isn't it? Is that what you're suggesting?
Yeah, well, I think, certainly children and young people reflect to me that really any time between sort of grade 3 and grade 5, they know they're in serious trouble.
Yeah, okay.
Mental health-wise, they will pinpoint, I knew then that there was something really wrong with me, and that's to use their language. I'm not projecting that onto them. And, of course, when you look at what may have been happening to them physically, psychologically, there's just an awareness. So, there's obviously a period there where most children are at school in those very early years. So we do have them captured in that moment. So, it's not the only solution, but we often talk about, the teenage years as the rocky years. There's, as I understand it, more investment in school psychology and social work services in high schools, for example. But from my point of view, it's way too late. It's actually in primary school where those sorts of intensive supports are needed, because the process of engagement and the capacity of schools and other services to provide intense engagement is limited. So if you're starting that really late, it doesn't give you much of a runway before suddenly teenagers find themselves very much at the end of their schooling without really having engaged much at all from grade 7 onwards.
And Catherine, I know you've worked in other states as well, and you're across national and international research. Is that in every place, or is it very specific to Tasmania?
That's a great question. Of course, these are universal issues, and even if we just take abuse and complex trauma, they are universal issues. And if we understand those as not the only driver or experience in vulnerable children and young people's lives, but as potentially a central one, it's universal. I think the combination of trauma and poverty is something that's, well, again, it's not unique to Tasmania, but I feel as though elsewhere there may be cities or suburbs where that's not quite so much the case, whereas I feel like that's a generalised state in Tasmania. And I think discussion of poverty, I don't know, it seems to have fallen off the agenda. And potentially in the context of Tasmania, obviously the Commission of Inquiry has, driven a real focus on trauma related to sexual abuse and physical abuse, but only in institutions actually, which for me is like just the tiniest part of the actual picture. So I feel as though there's a broader focus in the community around trauma and abuse, and that's very positive, but I feel as though that's potentially led to a lack of dialogue and awareness around the impacts of poverty as also a key thing that needs to be addressed to enable children and young people to live their best lives. And I think it perhaps is easier to focus on interpersonal grief and adversity rather than think systemically about what are the core things that need to change so that children and young people have access to good housing, have schools that are incredibly well resourced to support them with the current needs that they have, and not think about it as, how do we fix individual children and young people? We need to flip that around, and I think a poverty-informed lens helps us with that, to think about how do our systems and services actually do better for individuals rather than how do we fix these so-called problematic individuals that are failing.
And I think one of the exciting things is the research that you're doing and how it can inform that conversation, because often people go, big wicked problems. But actually there are also big wicked solutions if people want to get together across those silos that we've sort of artificially created, which have helped in some ways, but absolutely hindered those people who have really complex traumatic backgrounds and who are, as you say, living with generational poverty. So I really want to say thank you very much. We could probably talk for hours and I'd love to do that, but I'm aware that our time's almost up. So thank you so much. Keep doing your great work that you do. And that's through, Homelessness Australia and the boards that you're on, like Why Not, the Youth Network of Tasmania and Home Base, but particularly through working with young people and providing them with a space to have a voice.
Thank you, Michelle.
Thanks, Catherine.
You've been listening to the Breaking Barriers Building Futures podcast, presented by the Tasmanian Community Fund. The fund seeks to increase community wellbeing by removing barriers to learning and help Tasmanians to develop, deliver and lead responses to their needs. For more information, go to tascomfund.org.